Imagine this. Inside your body right now, two small organs, about the size of your fists, are working non-stop. You don't feel them. You don't hear them. You don't even think about them. But every minute, they are filtering your blood, removing waste, balancing fluids, controlling blood pressure, and even helping your body make red blood cells. Those two quiet heroes are your kidneys. And the scary part, when they start failing, they often do it in complete silence. No dramatic warning, no loud alarm, just small whispers your body hopes you'll notice. Today, we're uncovering the truth about kidney failure, the early red flags most people ignore, how it silently progresses, and the life-saving actions that can protect you or someone you love. Let's start with something that might shock you. Many people don't realize they have kidney disease until it's already advanced. Why? Because in the early stages, the symptoms are so mild, they seem harmless. Feeling a little more tired than usual. Slight swelling in your feet. Changes in how often you pee. It's easy to blame stress, dehydration, age, or just a bad week. But your kidneys are deeply connected to almost everything in your body. When they struggle, your whole system slowly feels it. One of the earliest red flags is fatigue. Not just I stayed up late, tired. We're talking about a deep, heavy exhaustion that doesn't go away with rest. When kidneys aren't filtering properly, toxins build up in the blood. That buildup can make you feel foggy, weak, and drained. Another early sign. Changes in urination. You might notice you're going more often at night, or maybe less than usual. The color could change. It might look foamy, which can signal protein leaking into the urine, something that should never be ignored. Swelling is another quiet warning. Your kidneys help remove excess fluid. When they can't keep up, fluid stays in your body. That can cause swelling in your ankles, feet, hands, or even around your eyes. It might seem small at first, just a little puffiness, but it's your body saying, something isn't right. And here's where it gets serious. Kidney disease often progresses silently over years. Conditions like diabetes and high blood pressure are the leading causes. They slowly damage the tiny blood vessels in the kidneys. You might feel completely fine while the damage is happening. That's what makes it dangerous. By the time severe symptoms show up, nausea, vomiting, shortness of breath, chest pain, confusion, kidney function may already be critically low. There are two main types of kidney failure, acute and chronic. Acute kidney injury happens suddenly, often due to severe dehydration, infection, certain medications, or blockage. The good news, it can sometimes be reversed if treated quickly. Chronic kidney disease, on the other hand, develops slowly over time. It doesn't usually go away. It gradually worsens through stages, from mild damage to complete kidney failure, also known as end-stage renal disease. When kidneys fail completely, the body cannot survive without treatment. At that point, options include dialysis, a machine that filters your blood, or a kidney transplant. Dialysis can be life-saving, but it's demanding. It often requires multiple sessions every week, each lasting hours. It changes daily life. A transplant offers more freedom, but comes with its own challenges, including lifelong medication and waiting lists. But here's the empowering part. Kidney failure is not inevitable for most people. There are life-saving actions you can take starting today. First, control your blood pressure. High blood pressure quietly damages the kidneys over time. Regular monitoring, reducing salt intake, staying active, and following medical advice can make a massive difference. Second, manage blood sugar if you have diabetes. Keeping glucose levels stable protects those delicate kidney filters. Hydration matters too. Drinking enough water supports kidney function, especially in hot climates or remote areas where dehydration can happen quickly. But balance is key. Excessive fluid intake isn't helpful either. A steady, healthy amount throughout the day is usually best unless a doctor advises otherwise. Be careful with medications. Overusing painkillers, especially certain anti-inflammatory drugs, can strain the kidneys. Always follow recommended doses and avoid mixing medications without guidance. In areas where medical access may be limited, this is especially important. Self-medicating frequently can cause hidden harm over time. Diet plays a powerful role. reducing excessive salt, limiting processed foods, and being mindful of protein intake, if you already have kidney problems, can protect kidney health. Fresh foods, fruits, vegetables, and whole grains are generally supportive choices. Smoking also increases the risk of kidney damage. Quitting doesn't just help your lungs and heart, it directly protects your kidneys. And perhaps the most important action of all, get tested. A simple blood test to measure creatinine and estimate your glomerular filtration rate, along with a urine test to check for protein, can detect kidney problems early, long before symptoms become severe. If you have diabetes, high blood pressure, heart disease, or a family history of kidney issues, regular testing isn't optional. It's essential. Now let's talk about something deeply human. Kidney failure doesn't just affect lab results. It affects families. It affects routines. It affects mental health. The uncertainty, the fatigue, the lifestyle changes, they can feel overwhelming. But early knowledge changes everything. When caught early, progression can be slowed. Lives can be extended. Quality of life can be preserved. If you're watching this and you've noticed swelling, unusual fatigue, changes in urination, or if you live with diabetes or high blood pressure, don't ignore it. Your body whispers before it screams. Listen to those whispers. And if you're currently facing kidney disease, know this: you are not alone. Millions of people manage kidney conditions every day. With medical guidance, lifestyle adjustments, and support, many live full, meaningful lives. Modern medicine continues to improve treatments, dialysis methods, and transplant outcomes every year. Your kidneys work for you 24 hours a day. They never take a break. The question is, will you take a moment to protect them? Kidney failure is often silent, but awareness is powerful. Pay attention to early red flags. Understand the silent progression. Take life-saving action before it's too late. Because sometimes, the smallest organs make the biggest difference.